Good afternoon. My name is Elizabeth Hess, and as you can tell from the background, I am not in the City of Urbana building. This is not UPTV. I want to thank our producer, Jason Liggett, for helping us record this remotely. We are at the point right now, according to our guest, Champaign-Urbana Public Health Administrator Julie Pryde, we should not be congregating. This is for safety. The City of Urbana building is doing everything it can to have people work from home right now. We should all be sheltering in place. Good afternoon, Julie, and we're going to talk about this. Thank you for joining me today.
Thank you.
Tell me a little bit about what shelter in place, what does it mean exactly?
Shelter in place or the stay home order, or whatever it's called in various places, just means that we want people to stay out of public, to stay away from other people, and even when you're in your own home, to stay away from people if you can. Obviously, if you have children, that's not even possible, but to stay away from people as much as you can and stay inside as much as you can. If you have to go to the grocery store, do that. Just one of you go to the grocery store, and make sure that you stay away from other people when you're there. If people start creeping up on you on the line like they do, like I'm known to do, just ask them to please step back, that you don't know if you're infected and you don't know if they're infected, because that's essentially where we are. We don't know who's infected, and we don't know if they're asymptomatic, and we don't know if they are incubating, and they might start showing symptoms at any time.
We're talking about essential personnel. We started talking about doctors and nurses. Now we're talking about people in the supply chain. So grocery stores are open. We need to be sensitive to people who don't have the choice of staying at home. Grocery store clerks are also there. A little kindness is going a long way right now.
Yes. I actually have a daughter who was called back in so the older people could stay home. I let that go for a little while, and then once they added asthma to the list, I told her that I would like her to stay home as well. The people who are working in there they need to be treated kindly. I know that people for the most part are, but they're out there. They're making sure that you're getting your groceries and everything, and they're doing so at risk to themselves. They really are. And staying away from them in line, staying back as far as you can when you're paying for your groceries, things like that will go a long way toward their safety and yours.
And I went to the pharmacy this morning. I went through the drive-through. When someone takes your credit card and hands it back to you and hands you your medication, what are the rules for how long we can touch it? When do we need to wash our hands after touching our credit card? What are these rules?
Well, this is really the same rules that we would want people to do all the time, but none of us do it. So what that means is that assume everything you touch all the time is covered in germs, because it is, and just do your normal thing. And then when you get home, make sure you wash your hands really well. Assume your credit cards are dirty, your cell phones are dirty, every door handle you touch, everything you touch in public, and just what I get a lot of questions about groceries, and I tell people, just go shopping, bring your groceries home, put them away, and then wash your hands really well. And if they've been sitting on the counter, go ahead and you can spritz your counter off with some, like a third cup of bleach and a gallon of water, and spritz that off and let it air dry, and just go about your day. The people are going to be infected. They're going to have the biggest chance of being infected if they're out there and they're breathing in someone's air who is infected. That's going to be, that's going to be the number one way that people are going to get infected. The other way would be to get germs on your hand and then touch your own eyes, nose, or mouth. You're not going to get them if they're just on your hand and you don't touch your face, but most of us do multiple times a day. So every time you think about it, wash your hands. So if you've been out of your house, come in and wash your hands. If you're getting groceries out and you have already put them away and you've washed your hands, then you come back in later to make dinner and it hasn't been a couple of days, then still assume that can is contaminated, or that box or whatever you're using. And then after you pour it into your bowl or your pan or whatever, then wash your hands again. Same thing if you're picking up food through a drive-through. Same thing, take it home, put it on its own plate or a paper plate or whatever, however you want to do it, and then just wash your hands before you eat it. It's just a matter of thinking about that things are going to be potentially contaminated, and you want to avoid getting those germs into your eyes, nose, or mouth.
I mean, letter carriers are the same thing. They're all still working. So when you get your mail out of the mailbox, you're opening the handle, you're opening your front door to go back inside. Just set things down and wash your hands is what you're saying after anything that you touch.
Yep. After you're doing whatever you're doing, just go ahead and wash your hands. Most of us luckily don't bring our mail in and lick it, so that's a good thing. But we do, you have germs on your hands all the time. So just up the hand washing. And it does not need to be hand sanitizer. I keep saying that to people. They're almost obsessed with hand sanitizer. There is nothing magical about hand sanitizer. Good old plain old soap and water and vigorous scrubbing is really the best thing. It gets off more germs than hand sanitizer.
It's the friction and the soap and the washing down of the germs, right?
It is. Yep.
Let's talk about personal protective equipment. Hospitals are rumored to be running out of them. At home, we don't need our own gloves and masks if we're not going to go out of the house. How important, how imperative is it that the hospitals and medical providers have these right now? And where are we getting more from?
Well, the main thing with this is, first of all, our hospitals and our healthcare providers are on like it's sort of a pyramid type of a graph that shows who needs help, who needs what kind of personal protective equipment for what type of activity. But yes, they need it, and we need it produced by the truckloads and by the train load in this country. It should be getting produced. It's something that's going to be needed, not just here, but everywhere. We only have so much in the strategic national stockpile. I know right now that our healthcare providers are okay, but they need more. I mean, they're going to need more, and it alters how they do their services. So we keep hearing that it's promised that it's coming, but we're looking everywhere for it. I can assure you that our county is scouring every place for it, but so is the rest of the world. So we really need to ramp up production in the U.S. and keep it going.
There are wonderful local groups making protective masks, sewing them. But from what I understand, those are decorative to remember not to touch your face. They are not going to protect you from the virus. Is that correct?
Yeah. So those cloth masks are, what they really do are, it's kind of, they're making homemade masks to replace surgical masks. And surgical masks are not to prevent you from getting the virus or any other thing. It is, those are respirators. What those type of masks do is prevent people from coughing and sneezing out into public and getting germs out there. And it also will prevent people from touching their face, because we inadvertently do it all the time. And if you have that on there, and it's at least going to stop you from touching your eyes your nose and mouth.
Your eyes as well.
And they're not going to be used by hospital staff. But I can see, if everybody was wearing one around, assuming that everyone was infected, that would be okay to do, but it's not to replace social distancing. So in other words, don't get these masks on and then think that you can just hang around people or go into public places or crowds and get around others, because they will not prevent you from breathing a virus in.
Julie, our public health officials are so concerned about not overwhelming the hospitals. This is why we're sheltering in place. This is why we're social distancing. Are the current hospitals that we have here in Champaign-Urbana, we have 2 health systems. Are they currently overwhelmed, or are we on our way there?
They're not overwhelmed. They are doing a great job of doing exactly what they need to do, way ahead of the curve, luckily. I mean, we are very lucky in this community. I say this all the time, but everybody is on the same page, and certainly the hospitals know what they need to do to prepare for any type of surge. And pandemic planning is a part of their planning. They have plans, they have surge capacity. We have the University of Illinois in our community, which we are very lucky to have, and they're working on stuff all the time. And they have a lot of resources and a lot of space and all kinds of things. So they're doing exactly what they need to do. And I know people are getting angry that like elective surgeries are being postponed and stuff. That is all part of planning for planning for an increase in the need for hospital rooms and for critical care facilities. So they're doing, as I'm sure no one's surprised, they're doing exactly what they need to do, and they've been working on this since we all in public health and medicine knew that a pandemic was coming, which was in early January. So they're working on it, and they're doing a great job.
It bears repeating from you right now that it is for our own public safety. The hospitals don't want you to have to be away from your loved ones while they're in the hospital, while they're giving birth. It bears repeating right now. There is a reason that we are doing this and limiting the number of people in hospital rooms.
Absolutely. First of all, to conserve personal protective equipment. The other thing is to not risk any more infection. I mean, I know that all of the new rules and things that are being put in place are confusing for people and they're frustrating for people, but they really are to save lives overall. That's what this whole entire effort is about, saving lives. And you need to make sure that you have as much capacity in your facility as possible. And that includes the staff. I mean, we've got, nurses, doctors, techs, surgeons, everyone, anesthesiologists, everyone in the hospital system needs to be prepared for an influx. And that's what they're doing. And so it's not business as usual, but it's business as it needs to be.
I've seen most of the churches, mosques, synagogues around town going online with that. Some have not, though. Can you stress the importance of not going to places of worship right now and finding the new normal in that avenue as well?
Yeah, and the vast majority of people have, and the ones who didn't did so after the governor's order. If there are some that are remaining open and we haven't found out about them, all I can say is that you are absolutely putting your congregation at risk. You're putting your congregation at risk because if you're open, they're going to show up. And this is especially dangerous for people with underlying health conditions that you may not even know about. We're also starting now to see cases around the U.S. in kids and young adults that are serious as well. So this is not something to mess with. It is. It's not going to be as easy as, well, if you're sick, stay home, because now we know that there is a symptomatic transmission. So people need to stay away from each other, and we do not need to provide any excuse for people to gather.
And that was my next question, is if you're a healthy 34-year-old with no symptoms, it doesn't necessarily mean that if you get it, you're going to be fine. You have to be vigilant. 50% or more are people under the age of 50, I just heard. So people are getting it under the age of 50.
Oh, absolutely. I mean, we've known all along that they'll get it, but now what we're finding out with the data that's coming out in the U.S. is that there are serious cases among kids and young adults as well. So they're also being hospitalized. So not only are they getting it, but they're being hospitalized, and some of them are in critical condition.
When you talk to people, I'm sure everybody wants to know, how long are we going to be sheltering in place? How long are we going to be in this peak? Do you actually know the answer to any of that? How long?
I don't know the specific answers because I'm not in charge of the orders to how long things are going to last, but I can be very honest with people and let you know that a pandemic of a respiratory virus is not going to end until we have herd immunity. And that's either going to be through vaccination or infection. And I've heard people saying, oh, well, let's just let everybody get infected and then protect the elderly. It's just not that simple, because it's not like only the elderly are going to have basically scary outcomes with this, or needs critical care. That's not how that works. So it could be a long time until they're talking a year to 18 months before we have any type of vaccine, and then it has to be able to get into everyone and to be able to have herd immunity. So that's talking about, I don't even know exactly. It can be anywhere from 50 to 80%, depending on the virus, or even more, depending on how infectious it is. So there's still a lot of unknowns, but people need to understand that we're looking at a long period of disruption. And I know that's scary, and I feel extremely bad for people who are not, who have lost their jobs or who are not working or who their businesses are suffering. That is something that we need the federal government to address, absolutely. And locally, we're also working on that. We have lots of places trying to help with that. But it is going to be, a long period. I'm not saying we're all going to be locked down, as they call it, for this long, but there probably will be times where it will be relaxed a little bit, and then the numbers will start climbing, and then we're going to have to do it again. That doesn't mean we're going to have to do it nationwide. It will be based on community numbers. So I know that we could, if we started seeing something happening locally, we would definitely want to do it within our county, because that's really the only place that we have authority, whether it's public health or the county government or the cities or whatever. But so it will be a long time for new normal, but it is going to end. Pandemics end. They will, and people are doing the right thing, and we're, as long as we can keep our healthcare systems from getting overwhelmed, which I am confident that we will here. I cannot say that everywhere else in the United States, and certainly not the world. But pandemics are they're tough things. H1N1, it didn't have as high a mortality rate, so people didn't really we didn't see the same type of reaction. We also knew that we were going to have a vaccine for that relatively quickly, because it was a flu virus and all that was already ready to go. Basically, they just had to get the ramp up production and put in the new strain. But
so that's the big difference between H1N1 and what we're currently experiencing now, is the mortality rate is that much more to fear.
It is, and it is. That's why you're seeing extreme measures again, and just not only the mortality rate, but just the number of cases in the hospital. Because if you overwhelm your healthcare system, what happens is then people can't get in for other things, a heart attack or things that are normally survivable, any number of things, an asthma attack, an accident, all kinds of things. You have to keep your healthcare system operating, and that's not just the facility and the PPE and the equipment, but it's also the staff, and it's the resources. So really, people have got to understand that staying home is helping that. It's helping our healthcare system, our healthcare providers. It's helping the people at the grocery stores. It's helping our first responders. It's helping everyone who cannot shelter in place, who have to be out there on the front lines doing the tough work every day.
Julie, who is your network of people that you listen to? Is it former public health officials in counties, around the state, nationally? Who are you working with each morning when you pick up your phone and check in with?
Well, I mean, we always look to, the Centers for Disease Control. We've been monitoring World Health Organization. We look at what's going on in other countries. But we also, of course, look at the state health department. We work really closely with them, and then we have a big network around us. But we didn't really wait for guidance on a lot of the stuff early on, because we knew what was happening. We knew it was going to be a pandemic, so we started trying to get people prepared for that early on. And I don't think most of the public even realizes we did that, because they probably weren't listening to us, at least a lot of them, the ones on our Facebook page perhaps. But it wasn't until the sports stadiums and places started closing down, and thankfully they did that, and they did that on their own. They did not do that through federal guidance, which was really needed. I mean, really need to take this. It needs to be a nationwide thing, because you can see what happens when one state's doing a good job or one locality is doing a good job, and then you have places like Florida who didn't close their beaches and didn't close their hotels and allowed the spring breakers down there. Those kids are then going to go back all over the United States and possibly elsewhere and seed other outbreaks. And we just have to wait and see where those are going to happen. So, we have to be thankful in this country that a lot of places stepped up and did the right thing early on, and certainly the sports teams really caught people's attention. That really got people's attention, and the concerts being canceled and all of that. So,
and Olympics, that's the latest. The Olympics have been postponed.
Yeah.
I
mean, for the Olympics to go on would absolutely be a public health disaster, because people would be coming in from all over the place and then going back, and that would be very bad.
Julie, have we peaked? Have we seen the worst of it, or will we have a further outbreak right now? We are a few days, a week behind Italy, but have we peaked already?
No, we have not peaked already. And peaks will come in different places as well. It's not just the whole, United States. Locally, we know again, without testing, the testing that we needed early on, we're playing catch up. We don't even know what we know it's out there, but we don't really know the numbers. We have no idea. Locally, we've done, not a ton of testing, but way more than a lot of places in the state. But with these mitigation efforts of everybody supposed to stay home, that will help lower the numbers. But no, there will be peaks coming and going, because again, even like with China, they shut everything down, and literally shut everything down for quite a while. And then the numbers went down. And now that they're starting to open up and go to work, then you're going to see those numbers start to rise again. And then they'll have to put other things in place.
So go out, you can take a walk, stay 6 feet from other people. If you want to interact with your neighbors, do it over a fence 6 feet away. Just don't touch playground equipment, common sense. This is the peak of it right now. Just listen to public health and stay away from each other is what I'm hearing from you today.
Yeah, absolutely. And I just learned something this weekend that I thought was cute. My great niece, they called their grandparents who were in their 90s, or their great grandparents, and they didn't even know that their phone had FaceTime on it. So of course it was up to her ear, and they said, "No, pull the phone down and look at the phone." And she just about couldn't even believe she just could not believe what she was seeing. And so there are ways to reach out to people. It's going to be different, and certainly it would be better to hug them. Of course, we all know that, but for now, we just have to come up with new ways to connect with people, to be nice to people, to answer questions, and to just understand that we're in this for a while, and we're going to, luckily spring's coming, then summer's coming, and then fall's coming. So we'll at least get outside some, and that will be nice. And absolutely, you can go out and take walks and things like that. As long as you're not congregating. And if you're in the house with a person that you're around all the time, you're going to not be 6 feet apart when you walk. But if you're sleeping in the same bed, that's not going to matter anyway. So we don't have to worry about something like that. We'll get through this. And we just have to understand that it is going to be a while, and we need to figure out ways to do things differently and to include everyone.
And if you have a phone number or a website, now's the time to give it. We'll have Jason put it up on the screen.
Okay, we have the COVID hotline, which is 239-7877. We're trying to answer all questions from anyone and make referrals if necessary to other places. We have an email, which is coronavirus@c-uphd.org. And same thing, we'll answer a lot of questions in there. We try to put things on Facebook, including funny things if I can find them. Sometimes I think I'm funnier than I am, so you'll just have to all bear with that for a while.
You're funny. I'll vouch.
Funny at all. But I am.
You are. So, thank you so much, Julie, for everything. Julie
you.
Pryde, the administrator of the Champaign-Urbana Public Health District. We will continue to do this, and we really appreciate your ability to not just make us feel safe, but to warn us what's coming up. So thank you for that.
Thank you.
I want to thank Urbana Mayor Diane Marlin, our producer Jason Liggett. Thank you for setting this up in 3 different locations, City of Urbana, UPTV. But again, Julie Pryde, you are, and I don't use this lightly, but a community treasure. Thank you so much for all of your efforts.
Well, I have to say, I keep saying this, but it is the truth. I may be the one out front doing a lot of the talking, but there is a massive machine behind behind us doing all this stuff, not just here at Public Health, but all levels of government and the hospitals and the U of I and the community members. I've said this since the beginning, and I'm sticking by it. Our community will do fine through this because we have relationships built, and we've had them built for years, and we just have a great community. So
we really do.
It makes a difference. It makes a difference.
It does. Thanks for everything, Julie.